Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation, and chronic daily migraine survivor. I am super excited to tell everyone that I am here today with Dr. Cynthia Armand. Dr. Armand is an assistant professor of neurology at the Albert Einstein College of Medicine, Montefiore Medical Center. She is also the fellowship director at the Montefiore Headache Center. Hello, Dr. Armand. How are you today?
Hello, Dr. Weitzel. It's very nice to be here. Thanks for having me. Great.
We are so excited to have you here today. Dr. Armand is really awesome. She is very popular. People love her. Her patients love her. I have seen her online. I have followed her. And we have been really excited for a long time to have her here on our podcast and our webcast. We have a topic today that we have not covered before, but we've wanted to. I think a lot of you have questions about this, and it is headache diaries, migraine diaries. It sounds simple, but there are a lot of things that we want to know about them. Should we have one? Are there really reasons that we should have one? Are there reasons we should be keeping track of the severity, the frequency of our migraines or our chronic headaches? Or should we sort of be ignoring that so that we can focus on more positive things? There's a lot of different thoughts out there. I saw Dr. Armand speak about this a little bit online, and I just thought she would be the best person to ask these questions to. So let's hear what she has to say. So Dr. Armand, do you recommend that your new patients, people who come to you who you haven't seen before, use a headache diary?
Yes. So I really think that the new patient visit is something that can be pretty daunting.
Right.
A lot of patients view it as a high stakes situation. They've been maybe waiting months, even up to a year for the appointment. And a lot of what they're experiencing from day to day, they kind of just get shell shocked a little bit because they have to kind of condense all of that into maybe 40 minutes to even 60 minutes. So I do think documentation is important. So what I think people should do is, yes, they should keep a headache diary. And for me, the headache diary does two things. It provides information and also organization. So the informational piece kind of speaks to what the person is experiencing, the headache type. They learn much more about their bodies, and they're able to convey that information to a provider just like me. And then the organizational tool, the headache diary is able to keep that information in one place so that when it's time to convey that info, it's all there. It may be organized into kind of however the patient wants to put it down, but it's all in one place. And that allows the provider to take an in-depth look as to what's going on when they're meeting the patient for the first time. And there's no issue with recall, right? So a lot of individuals with migraine disease can have difficulty remembering things, especially if they're maybe recovering from an attack, if they go to that same visit. So documenting keeps it there on a piece of paper or on an app, and it virtually takes away the recall, and you have information that's there, and you don't have to worry about what's being missed.
Okay. So just out of curiosity, it sounds to me like you are talking about a diary that they would keep before they came to you, before that first visit. Is that true?
Yes.
Okay.
It would be great. That's a great starting point to keep it before they come.
Okay. All right. So how about patients who have had migraine for years? You know, those of us that have been doing this 10, 20, even maybe just 5 years, are chronic. Do you often and you've already seen them, do you often recommend that they still keep taking a diary?
Yes, I think my recommendation for all patients is pretty much the same. I think that the record keeping should be consistent. However, throughout my practice, I feel like that I've evolved from the first day I started practicing to now. My patients teach me a lot, and many of my patients kind of have difficulty with doing that, and they're actually pretty honest with me. They tell me, I this is annoying. I can't keep doing this, so we got to change something. And honestly, I do think part of migraine care is individualized care, and I have to really cater to the strengths of my patients. And if someone is not able to do that or finds it actually pretty stressful to do that,
Right.
then you know what? I'm not tied to it. I think we could talk about ways of record keeping and ways of honing in on specific symptoms that they might have from time to time, and then go with that.
Right. That sort of leads into my next question, because I have noticed that a lot of the people I talk to can benefit from maybe more of a functional pain scale instead of like my pain is somewhere between 1 and 10, maybe more of a somewhere on a 3-point scale of I'm either doing great, functional, yes, or bedridden kind of a scale, instead, yes, of my pain's a 1 to 10, or say other things that keep them with more positive words in their mind, or something like that. Right. What are your thoughts on that? Do you think some people are kind of hurt by the 1 to 10 pain scale?
Yeah, so I do see a fair number of individuals who have chronic intractable migraine where, right, they have a baseline level of pain. And yes, sometimes I tell them, okay, let's understand what your baseline level of pain is usually. Mm-hmm. And a lot of the times they might say, okay, well, I woke up with a 6 and it's always a 6 and today it's a 7. And you know what? Concentrating on this is too much. Right. So you know what I switch to? I like switching to what they're able to do and what they can't do. So, right, and you find people kind of like that because they'll say, well, I was able to do a load of laundry on this day, and that means I was having a good day. I was able to have dinner with my family uninterrupted. I finished from, I was able to concentrate. I was engaged in the conversation. I went to the family reunion. And so all of these markers of living and examples of being able to function at normal capacity, I think keeping tabs of that tends to be on the side of kind of joyous and less tedious for patients, right, that I find.
Right. So what are some reasons? I know that there's some reasons that we may find in the future that we might really need to have headache diary information on record. So what are some reasons that we might need it?
Right. So the first thing is gaining knowledge about your symptoms, gaining knowledge about you and what's going on in your body. The number one thing that patients usually tell me when they come for a new visit is, I know my body. Everyone else is not listening to me. I need you to understand what's going on. And I want to tell you what's going on with my body. You know what? Great. I want to know what's going on with your body too, because I'm not you. So the record keeping, I think, really establishes that. And I think it empowers patients. And I like that a lot. The second thing is helping your provider during the visits, right? I always say, help me help you, kind of meet me halfway. And how do you meet me halfway? That record keeping, because honestly, it gets rid of the recall. I tell you the truth, I can't remember what my headache was like 3 weeks ago. I had a 3-day long headache and I can't even tell you where it was. But if I wrote it down in my diary, like I'm telling you that patients should do, I could look at it and say, okay, well, I had it on this side of the head and it was burning and it was such and such. Okay, fine. So now when I have it again, I can say, oh, this is the similar type, right? So I'm able to give that information to my provider so that my provider can understand the process, make more of, understand my disease process better so that they can get to the diagnosis better. And also it helps myself and the provider make medical decisions together better. And then the last thing is assessment of treatment response, right? So the response to treatments are not always going to be this aha moment, right? It might be something that's gradual, a gradual change. And in order for you to catch that, notation is helpful. So those are the 3: gaining knowledge about yourself, helping the provider during visits, and assessing if treatments work or not.
I think the assessing of treatments is so important. I was just talking to someone yesterday who had daily migraine for years, and she just randomly looked at her notes and we had been talking for like 30 minutes. And she said, then I had 6 days of no pain. And I said, rewind, you had what? And she hadn't even, noticed. And so it's true, because you do block things out, because a lot of people don't want to spend their whole day thinking about pain. Right. And so you tend to block it out. But what about disability? if, you know, unfortunately it is something that a situation some people find themselves in, they end up having to apply for disability. Will they need this information in their medical record if they end up in that situation?
Right. So the disability paperwork is something that is extensive and highly detailed. And the more information that you have, the more detail that's there, it's more likely to help in your case. So yes, that information is really important to have, especially if it's present at every visit, right? So again, for those purposes, we never want to get there. We don't want to get there, but honestly, you have to be prepared, right? You have to be prepared.
Right. Are there any specific apps that you recommend or you like for the purpose of keeping a headache diary?
So I really like Migraine Buddy.
Okay.
I find that the majority of my patients appreciate it. It can allow for simple notation, and it could also allow for detailed notation. And my favorite part about it is that my patients can copy and paste the link and send it to me through the portal. And all I have to do is click on the link and bam, the diary is right in front of me. And I can review it before our visit together. So that I really like.
Okay. All right. What information do you find most important for your patients to include in their headache diary? Is it just level of pain, or do you like the type, like throbbing, burning, duration, medications used, whether or not they worked?
Yeah. So I would like to know everything about the pain. So the basics of the pain. So basically, how often the pain is happening, where's the pain located, what's the quality, is it throbbing or burning, what's the severity, that might be a 10-point scale, or that might be an assessment of function. How long did the headache last untreated, and how effective were the treatments utilized, and actually what those treatments were. Those are the basics that I would start with.
Okay. Do you recommend logging different information at different stages of treatment? For example, if I'm newly diagnosed, I have episodic migraine. Do you want different information from me than someone who's had chronic migraine for 15 years?
Right. So I think those characteristics that I named are kind of the basics.
Okay.
Then once that information becomes easy to notate, it's a little fancy and add different things, right? Because I have individuals who ask me the longer they have migraine disease, the more questions that come up about what is actually triggering this. Like, what do I have to manage in order to figure this out? So, okay, get those characteristics down first. All right. Then we're going to move on to other fancy things like, okay, what may be the potential triggers? What was maybe surrounding the attack that you had the other day? We're going to concentrate on food now, and then maybe we might concentrate on weather. So I think the diary evolves over time, the longer someone has a disease. And I do find certain individuals may not want to do that quickly. They might take some time, or certain individuals are ready for that. And there are certain apps like Migraine Buddy where there's a little section where you can kind of notate, and you can add that on if you'd like. I don't think my advice would be always to start the basics and then go. If you're ready and you have the basics and you can go right away, by all means, but really concentrate on one thing, only because if you start out with assessing everything at once, it can be pretty overwhelming.
Right.
And then that leads to stress. And then that leads to despair. And then the mindset is just plummeting. And we don't want that. We want to be able to control what we can control, right? So little steps at a time, I think, will be helpful.
And I love that you use the word fancy, because I do think that a lot of us, I think if you focus a little too much on triggers, it increases your anxiety, and that's the last thing in the world we need. So
exactly, the last thing.
It's like, dear Lord, I don't know. Did the sun come in and hit my eyeball before that migraine? I don't remember. You know, the last thing that we need to do is get over focused on stuff like that. So what about if your patients have other types of chronic pain along with their migraine? What if they have fibromyalgia? I don't know, complex regional pain syndrome, back pain, anything? Do you want that in the app? Do you want that in the migraine diary, or does that just complicate things?
Yeah, I really think it depends on the person who's experiencing it.
Okay.
I do have some patients who want to know, when I have worsened fibromyalgia related pain, is that related to the migraine attacks I'm having? Is that triggering what's going on? In that case, it's going to be beneficial to write down what other bodily pains that you're having. And then we can answer the question based on a scenario. Okay, do I think this is contributing, or do I think it's not contributing? So I do think that kind of information would be beneficial.
Okay. All right. Is there anything else you'd like to add to our discussion on migraine and headache diaries?
I think the one thing I want to stress and reiterate, it's not supposed to be stressful.
Right.
That's what I want to reiterate. It's, patients, the most common comment I get about this when I talk about the diary, well, you know what, I can't whip out my diary in the middle of attack and then notate everything you want me to notate right then and there.
Yeah.
No. I don't want you to do that. I want you to concentrate on the migraine action plan that you have on hand. Maybe you want to call in somebody who's like the note taker. If you have family members, and all right, if I'm having an attack, you time how long this is, or you write down, put an X on the calendar that it happened. And then when you're recovering, or when it's after, when you're well enough, you can go back and kind of say, okay, well, it was on the left side. I had these associated symptoms with it, or I couldn't do X, Y, and Z. Because usually when you can't do certain things, like I couldn't have the lights on, I had to lay in a dark room, I couldn't hear the kids. That means the associated symptoms were light sensitivity and sound sensitivity. So, the functioning helps too. So you don't have to whip out the book or the app right in the middle of it. Just concentrate on getting better. Maybe tag team someone to help with it. If there isn't someone there, get better, and then put it in. And you know what? If you miss a day or two, okay, fine, so be it. So be it, right? I'm not, it's the homework that I give people. Homework is like practice, right? People get homework in order for them to master something. So it's homework, right? It's homework that you'll do from time to time, and we don't want you to get overwhelmed and feel stressed out by it.
Right. Okay. Yes. Don't let the things that we're trying to do to help our migraine stress us out and make our migraine worse. I think that's a great message. Well, thank you so much, Dr. Armand. And thank you everyone for joining us on this week's episode of Heads Up. Please join us again next week on the weekly webcast and podcast of the National Headache Foundation. Goodbye.
Thank you. Bye.